We all think about vessels in our heart closing, vessels in our necks closing. So let's just look at a quick vessel. All right, there's a vessel. It's an artery. This is our heart artery. The left anterior descending artery, the widowmaker. What happens to this artery? First, something has to happen to the vessel wall. Secondly, some plaque forms, so we've all heard about plaque. And this is different than the plaque in our teeth. Thirdly, something has to happen to this plaque. And the last thing that happens is not that the plaque gets bigger and bigger and bigger, goes to 80, 90, 100% closed. It doesn't happen that way. Something happens to that plaque to cause it to rupture. And when it ruptures, a clot forms. And this can be 50% closed, it can be 60% closed, it can be 90% closed. What causes this to happen? What causes that first change in the vessel wall? What causes that plaque to change to have a clot form? Well, we all know about cholesterol, right? Elevation in cholesterol. Plaque has cholesterol within it. Has these particles called low-density lipoprotein, LDL. We've all heard about those. Elevation in triglycerides promotes this. Well, that's what most people focus on. I have a high cholesterol. My doctor gave me some cholesterol medicine. I'm going to be fine. Well, that's not it, okay? Let's add a few other things. Let's add obesity. Let's add elevation in blood sugar. Let's add an unhealthy diet. All factors, even in skinny, wonderful, healthy people, if they eat really bad food all the time, it can promote plaque formation. What else? An elevation in blood pressure. Diabetes. Pre-diabetes. Kidney disease. People with clotting abnormalities. Go on and on. There are about 40 of them. What else? What's the worst one? Unfortunately, I can't do very much about that. But many of these things are modifiable. We can lower blood pressure, we can lower cholesterol, we can change unhealthy eating habits, we can improve the risk of people ending up with this, with a stroke if it's in the neck, with a heart attack if it's in the heart.